Hello, welcome to my PowerPoint. Today I will be discussing low intensity pulse ultrasound. So lipase has been around since the 1950s. 1950s, it was used for patients with tinnitus. In 2009, it was used to help promote soft tissue injury healing. And in 2014, dentists used it for the promotion of healing of enamel and teeth. Today, it is widely used for the promotion of bone fractures, specifically microfractures. Now, this is going to be used in a clinical setting for rehabilitation medicine and for therapeutic purposes. So we're going to see this a lot in physical therapy programs and orthopedic therapy programs. And so how this all works. So sound waves are produced by these piezoelectric crystals, and sound waves are then going to penetrate the body at very low frequencies. Low frequency is very important. So what they do is it creates low frequency and it hits this hard, dense object, which is the bone, and it can't penetrate it. So if it can't penetrate it, it absorbs all of it. And so what it does, the sound waves produce these bubbles, and these bubbles actually create turbulence or flow to the injured site. So you can imagine more flow to the injured site, what we're going to get is more nutrients to that injured site that the body needs, and getting rid of the waste that that injury doesn't need. So it promotes actually chemical reactions throughout the injured sites, promoting fibroblasts, chondroblasts, mesenchymal cells, and the list goes on. So throughout the board, all cells that are under lipase in that affected area are going to be doing their chemical reactions at a faster rate. So efficacy rates. On average, patients who use lipase during their physical therapy programs showed that they had a 40-day decrease in healing. So they're able to get back to doing what they're doing in in 40 days ahead of schedule. On the more extreme ends, we had patients going back within 17 days, and others 62 days early. So we're on average though, 40 is the number. So contraindications, what I could find is that anyone who has a fracture and is taking bisophosphonates while doing lipase shouldn't do it, because what this they actually found was during the remodeling phase of the fracture, healing was delayed. So those are the contraindications. If you're taking lipase, you can't be taking bisophosphonates. Vice versa, bisophosphonates, you can't be doing lipase. And the side effects of all of this is if the frequencies aren't calibrated correctly and are too high, what can happen is necrosis, decrease in bone healing, and finally the formation of fibrous tissue. So it's very important and pertinent to calibrate the machine correctly to your patient. And that concludes my PowerPoint. Here's the source material, and you can pause at any moment. I hope you have a great day.